Welcome back to the Situational Judgment video series. In this video, we will be looking at what the General Medical Council's Good Medical Practice Guidelines have to say about patient safety and honesty, and how this applies to the Situational Judgment Test of the UKCAT. Specifically, we will cover what the Good Medical Practice Guidelines say about safety and honesty, where we have already seen these principles being used, an example of these principles in use in another question. Safety and quality is one of the 4 domains in the General Medical Council's Good Medical Practice Guidelines. These state that doctors must take prompt action if they think that patient safety, dignity, or comfort is being compromised. They should also protect and promote the health of patients and the public. Can you think of examples of this being used in the questions that we've already seen in this video series? How about breaking confidentiality when the drunk A&E patient was driving home? Or the patient in A&E who was upset and said the nurse was denying her pain medication. In these situations, we were intervening to protect the public as well as exploring patients' concerns as their comfort and dignity may have been compromised. Let's look at another example of the theme of patient safety in action. As always, feel free to pause the video and have a go. Mike is a doctor working on a paediatric ward. One of his patients, a baby, is due to have surgery in the morning, and Mike was asked to ensure that the baby doesn't eat anything after 4 a.m. to be properly prepared for a general anaesthetic in the morning. He forgets to tell the nursing team, and the baby is given her 6 a.m. feed. Mike knows that it would now be unsafe for the baby to have her surgery as planned. How appropriate are each of the following responses by Mike in this situation? 1. Call the surgical team immediately to inform them that baby has been fed at 6 a.m. Is it A, a very appropriate thing to do, B, appropriate but not ideal, C, inappropriate but not awful, D, a very inappropriate thing to do? Once again, start by identifying the key issues. A key issue here is patient safety. Mike needs to ensure that the appropriate people are aware that this baby has fed, as he knows it will be dangerous if the surgery was to go ahead as planned. We now know that doctors should take prompt action if they think that patient safety is being compromised. The answer is therefore A, as it is essential that Mike acts and informs the surgical team as soon as possible about what has happened so that they can reschedule the operation.